Hello, I'm Dr. Krishna Susarla with Baylor St. Luke's Medical Group in Sugar Land, Pediatrics and Internal Medicine. And we are here today to answer a few common questions that many parents have about COVID-19 and children. That fevers and cough are the most common symptoms reported in both younger and older children. Older children may also report shortness of breath, body aches, and headaches. Other less common symptoms in both age groups include runny nose, nausea, stomach pain, diarrhea, and loss of taste or loss of smell. But it's important to realize that children can have minimal symptoms or absolutely no symptoms, just like adults. For those who do not know, multisystem inflammatory syndrome in children is a rare but severe complication that occurs in some children 2 to 4 weeks after infection with COVID-19. It's extremely important to understand that this is rare, so most children will not get this. And the few children who do get this will be obviously sick. They're going to have fever, GI symptoms, low blood pressure, fast heart rate. So this is not something that's going to sneak up on a person. They will be sick, and most parents will have taken their children to an emergency room by the time they have developed these symptoms. So really the take-home point about multisystem inflammatory syndrome and COVID-19 is that it develops in a few patients, but not in most, and that it can develop up to 2 to 4 weeks after diagnosis with COVID-19. So parents who have a child who has been diagnosed with COVID-19 should just be watching for symptoms 2 to 4 weeks out. Even if the child initially gets better, if they seem to be getting sick again with fevers or other symptoms, you should be keeping this in the back of the mind and having them evaluated for that possibility. So my answer here is if you have a reliable thermometer and the child is old enough and mature enough to sit still to get a reliable temperature reading, then I think this is a good idea. Most schools will probably have their own policies in place regarding temperature thresholds beyond which you should not send the child to school. If they don't, then I recommend that a child be kept home from school if they're having temperatures greater than or equal to 100 degrees Fahrenheit. And that would have been my recommendation even prior to the COVID-19 pandemic. So children who ride school buses are going to face some additional challenges when it comes to infection control. In general, if a child must ride a school bus, it would be best for the child to have gloves and mask and to be seated 6 feet away from the nearest other child. Obviously, this is something that the school district will have to make accommodations for in order to prevent buses from getting crowded. It turns out that the CDC also has some specific guidelines on this, which are available from their website. They specifically recommend that school bus drivers practice all safety precautions that are indicated for other school staff, that buses are cleaned and disinfected once daily, and that children are seated one student per row in every other row, except for students that come from the same household. They can sit in the same seat. They also suggest that bus windows be opened to increase circulation of outdoor air if that is deemed safe and possible, and that schools have physical guides to ensure that students and school staff remain 6 feet apart while they are waiting in line to board the bus. So if all of these precautions are followed, then I think it is reasonable to allow children to ride the bus. Again, it's something that you have to look at with your school district and make sure that they have these measures in place. And again, this also comes from the CDC. Some studies show that the COVID-19 virus can persist on surfaces for up to 6 days and still stay infective. But the good news is that many studies also show that various disinfectants and alcohol-based cleaners appear to inactivate the virus within 1 minute of application. So bathing immediately after returning from school, placing used clothes in a hamper, and placing potentially germy items such as backpacks in a designated spot to be cleaned, all of that would be expected to lower infection risk. This is an important question since older adults may be more vulnerable to the serious consequences of COVID-19, and because children can theoretically have COVID-19 and not have any symptoms, there's a concern that they could bring the infection home and transmit it to an elderly or otherwise vulnerable family member. First, I think patients who have suspected or confirmed COVID-19 should be kept separated from other family members and pets. I've always advised my patients that when they come down with symptoms of a viral illness, they should assume themselves to be contagious until proven otherwise. And even if we rule out COVID-19 infection, they should still remain separated so as to reduce the chance of spreading infection. Children who have undiagnosed COVID-19 and no symptoms could still transmit the infection. So some of the measures that could be put in place that could help to prevent this include having a separate bathroom and bedroom for the more vulnerable members of the family, keeping shared spaces well ventilated, using an open window or an air conditioner if that's deemed to be safe and reasonable, maintaining 6 feet of separation distance when in shared spaces. Consider having family members wear face masks when they are in close proximity to elderly or vulnerable family members. Masks with valves or vents are not protective and should not be used. I am seeing a lot of those outdoors, and they seem to be very popular, but they're not appropriate because they don't protect anyone around you. They only protect you. So standard surgical masks or cloth masks are acceptable. Avoid sharing dishes, eating utensils, and thermometers unless they have been thoroughly washed. All family members should get into the habit of washing hands regularly, especially before and after eating, brushing their teeth, coughing, sneezing, or having any contact with body fluids. Patients who need nebulizer treatments, such as patients who have asthma, COPD, emphysema, chronic bronchitis, they should preferably receive those treatments in an area of the house that minimizes exposure to other members of the household, because a nebulizer does tend to increase the generation of viral particles in the air. And preferably they should have the treatment in an area where the air will not be recirculated back into the house. The CDC gave some examples of, say, garages, patios, porches, and places like that. So all of these are measures that can be done. Of course, people should individualize their approach based on who is in the household and who needs to be protected. But those are all measures that can certainly be done. So once again, I'm Dr. Krishna Susarla with Pediatrics at Baylor St. Luke's in Sugar Land, and these were 6 questions pertaining to COVID-19 and children. Thank you very much.